Thank you for joining today's webinar. MedHQ is the leader in back office services for surgery centers. During the COVID-19 crisis, the team has been answering questions related to HR, the CARES Act, PPP loans, and more. They wanted to share their expertise with the industry. With that, I would like to introduce Tom Jacobs, CEO of MedHQ, and Rita Hernandez-Figge, COO of MedHQ. Tom and Rita, take it away.
Thank you, Lindsay. We are delighted to be here once again and have many things to cover. It's amazing how many new things come up every week, but we'll keep at it as long as there's a need or interest. So thank you for joining us.
Good afternoon. This is Rita. We'll get started.
Thank you. Okay, first off, as said before, we're not attorneys, so please know that we're not offering legal advice so much as just describing to everybody on the call how we're implementing the things that are being put into place regulation-wise. We do talk with our attorneys. We're jumping on attorney conference calls all the time ourselves, and gathering lots of information. But hopefully this is a resource for all of you just to see how we're implementing these things. There's so many things that impact human resources. It just made sense for us to do that. So hopefully this is helpful to everybody. And by the way, if you have any questions while we're talking, there's a way to submit those through the webinar panel. Please do so, and we'll address those throughout the discussion or at the end. Okay, so today we're covering two main aspects of the CARES Act, at least as it pertains to personnel and staffing. And those are the PPP loans, so-called PPP, Paycheck Protection Program loans, and Employee Retention Tax Credits. Secondly, we're going to talk about the ASC Association had issued some guidelines and checklists around repurposing ASCs for emergency support, let's say through a hospital. And we just want to talk about some of the HR implications of that. Thirdly, there's still more clarifications of the Families First Corona Response Act. I'm trying to get all my acronyms.
There are quite a few of them.
Quite a few. And then we have a few other questions already that we're going to address. But again, throughout, please submit your questions if you have others. We're relying in this PowerPoint, in this presentation, on a few main sources that are pretty recent. First off, the PPP loan program talks a lot, of course, about the Small Business Act. And in particular, we're going to talk about some definition type things that are in Section 3 of the Small Business Act. Secondly, there's just last night, late last night, probably 11 p.m. or so Eastern Time, from the Department of Treasury, some clarifications on the PPP loans. There were some guidelines around the employee retention credit issued about a week ago, but it's a less discussed topic. But I think as people get through their analysis of whether they can do PPP loans and find out maybe they are not eligible, they'll want to look at this option. Finally, the ASC Association. We looked at, again, their support of everything going on, and in particular this checklist that they put together. So first off, unfortunately, I'm doing most of the talking here for this first section, but Rita, please jump in if you
I will.
correct me or whatever. PPP loans and employee tax credits. So we've heard of things called, one questioner said, there were economic injury disaster loans, EIDLs, and PPP loans. Are they the same or are they different? If I've already got an EIDL loan, does that mean I can't get a PPP loan? So PPP loans are primarily meant to help businesses with specifically payroll costs. There is an element that helps rent and utilities as well, but primarily it's intended to be payroll costs. EIDLs, on the other hand, really started January 31st. So it was a program earlier in the process of COVID response. Did not require any regulatory changes, so it got kicked off very much sooner. And it falls under the kind of the normal rules, let's say, of the Small Business Administration Act, the SBA loans. So they're kind of normal SBA loans and can be used for, building, property, working capital, and those sorts of traditional things that SBA loans are used for. PPP loans, on the other hand, as mentioned, got started a little bit later, really enacted, what was it? It was probably about a week or so ago, maybe 10 days ago. So that's a much, later arrival. And again, address just payroll items, but can be used to cover costs from February 15th. So there is some backdating element to it through June 30th, 2020. It's a bigger amount, 10 million versus 2 million of the EIDLs. But the biggest difference is that the PPP loans have this very attractive element of loan forgiveness. So that's the reason I think most are going to be looking at the PPP loan and many fewer at the EIDLs, although we do know of folks that have done the first and are maybe thinking of doing both. So it is a possibility. How is that done? Really, if you have the one, then I think you refinance your EIDL loan with the PPP loan and kind of roll them together, is my understanding of how that works. So you can do both in effect, but they're really two different programs. Okay, the PEO world, which we are related to because of our business model, and surgery centers, a lot of surgery centers have contracted with PEOs, and how does that work? Well, finally last night, that clarification that came out from the Department of Treasury clarified that just because, well, first off, let me get into this question. My professional employer organization provides services to over 500 employees. Does that mean I can't qualify for a PPP loan? No, it does not mean that. Double negatives, triple negatives are kind of confusing, so let me just say it. If you have a PEO, you can still do a PPP loan. Okay, that's been made very clear in the FAQs that came out from the federal government. Let's see, wait a second, I'm going to try to get rid of something. I can see my screen a little better. Sorry about that. There we go. It's still up. I have part of my dashboard here covering my screen, so let me try to get through this description. The SBA's affiliation regulations now state that business concerns with employees from concerns primarily engaged in leasing employees to other businesses. So in other words, surgery centers who use PEOs, that's the way to read that, PEOs that primarily lease employees to surgery centers. When there's that relationship with the PEO, the surgery center is not affiliated with the PEO solely on the basis of that leasing agreement. Really, the reason for that last clause, that solely on the basis of a leasing agreement, we find a lot of leasing arrangements when you have a hospital that employs all the staff of a surgery center. Surgery center is a separate LLC, maybe even majority owned by physicians, let's say, but the hospital is employing the staff at the surgery center. That's an example of employee leasing. And so what this is saying is, let's say that case where the hospital owns more than 50% or has controlling interest in the surgery center and is leasing employees to the surgery center. Well, in that case, there is affiliation, and so you may not be eligible for the PPP loan. However, if, you know, in the normal sense of leasing, let's say from a PEO company to a surgery center, that's not affiliation. That's simply the PEO doing its job and the surgery center doing its job. Unrelated businesses, no co-ownership is the assumption. And so, you know, the surgery center is still eligible for the PPP loan. Too many P's. Sorry about that. Okay, second part of this question that we've seen a lot of. My paycheck, let me just say it, my PPP lender is asking for Forms 941 to determine eligibility. So what about that? Typically, the surgery center will not have its own 941s if they're using a PEO. So late last night, the Department of Treasury clarified that SBA recognizes that eligible borrowers that use PEOs may not have 941s on their own tax ID. In these cases, the payroll documents provided by the payroll provider, and this is quotation right from the FAQs last night, payroll documentation provided by the payroll provider that indicates the amount of wages and payroll taxes reported to the IRS by the payroll provider for the borrower's employees will be considered acceptable PPP loan payroll documentation. So the PEO is allowed to provide payroll information to the borrower. The borrower can give that payroll information to the bank, and that is acceptable from the point of view of the Department of Treasury. The eligible borrower should obtain a statement from the payroll provider documenting the amount of wages and payroll taxes, which every PEO will do, of course. In addition, again, kind of restating, employees of the eligible borrower will not be considered employees of the eligible borrower's PEO or payroll provider. So again, the surgery center is standing on its own. It's not caught up into the size of the PEO for this purpose. Okay, so how to calculate the loan amount? What time period should borrowers use to determine their number of employees and payroll costs to calculate their maximum loan amounts? Well, there are several methods. So we've seen this as we've helped our customers get the information pulled together that they need to make the loan application. We've seen banks, for example, ask for, well, you've given me all of 2019. I want the first 2 months of 2020 also. Okay, no problem. Technically not required, but we understand the banks still have a role, and they still need to make sure that they are following their own processes. So that's okay. PEOs can provide that. We can provide that information for the first 2 months of 2020 also, but not necessarily required. Where it's really going to matter, you know, what you specifically use is when downstream, after you've been through the process, had the loan, use the funds to pay payroll costs and some rent. At that point, you'll want to look back and use these specific definitions for what you're looking at, because that's when it's going to be what determines what your loan forgiveness amounts actually are. Okay, should payments that an eligible borrower made to an independent contractor or sole proprietor be included in calculations of eligible borrowers' payroll costs? So this is an item of confusion, because initially it was apparent that surgery centers would include independent contractor costs in their calculation of their total payroll to calculate the total loan amount. That's been changed as far as I can tell, because that was my understanding in the beginning as well. But now the rules are, no, we do not include independent contractor costs. And the reason being is because those independent contractors, not this week, but next, they're going to begin to be eligible to apply for a loan for their own business if they're eligible, given the whether they've had an impact from the COVID experience or not. Okay, second question. How should a borrower account for federal taxes when determining its payroll costs for purposes of the maximum loan amount, allowable uses of the loan, and the amount of the loan that may be forgiven? So another item of clarification. Under the Act, payroll costs are calculated on a gross basis, so gross wages, in other words. And you don't include any positive or negative or add or subtract from payroll taxes. Neither withholding taxes that are withheld from employees' paycheck, nor employer paid Social Security, for example. Those are not included in the calculation. So as a result, payroll costs are not reduced by taxes imposed on an employee and required to be withheld by the employee, but payroll costs also do not include the employer's share of payroll tax. Again, calculating the loan amount. The CARES Act excludes from the definition of payroll cost any employee compensation in excess of an annual salary of $100,000. Does that exclusion apply to all employee benefits of monetary value? And again, recently clarified is no, that you do not include, let's say, the employer cost of medical insurance, the employer's share. You do not include that in deciding whether that person has reached the threshold of $100,000 of compensation. Okay, so it gets very confusing because you do include the benefits costs when you're calculating total payroll amount that you use to calculate maximum loan or loan forgiveness, but you don't include it when you're excluding compensation above the $100,000 level. Okay, so that's our Q&A on how to calculate the loan amount. Now we're going to jump into this topic again of affiliations. So our small business concerns, and there's some, I'll say there's some surprising answers here. So hold on to your seat, because when these came out, it was a little bit surprising. I think you'll see why. Our small business concerns require to have 500 or fewer employees to be eligible, and that's everything we've heard up to now. And the answer is no. You don't have to be smaller than 500. A little bit surprising. So small business concerns can be eligible borrowers even if they have more than 500, as long as they satisfy the existing statutory and regulatory definition of small business concern. In other words, go back to that legacy SBA Act, and in particular, Section 3 is the area where you find definitions. So a business can qualify if it meets the SBA employee-based or revenue-based size standard corresponding to its primary industry. What does that mean? Well, I think I mentioned the last webinar we did that the Small Business Administration has a listing by Naics Code, or very similar to the SIC code that maybe many are familiar with. But it's a code that basically is an industry designation. And so the SBA has defined by industry code this NAICS number, whether, what's the threshold for being a medium size versus a small business. And for surgery centers, I think the number is $16.5 million of annual receipts, sales receipts or revenue. In fact, the definition in the traditional act for surgery centers does not list a number of employees. So the implication is by that standard alone, many surgery centers do fall under the small business definition. However, we'll get at this later, but affiliation, you have to look at affiliation first. So always start with affiliation, and we'll get into that in a little bit. But just on their own, independently on their own, the criteria for a surgery center historically has been $16.5 million of annual sales. Second bullet point here. Additionally, a business can qualify for the PPP as a small business concern if it met both tests in SBA's alternative size standard as of March 27, 2020. So again, a lot of specifics there, but again, this SBA Act, the traditional regulations have kind of a catch-all that says if your business has a maximum tangible net worth of not more than $15 million, so net equity is what that is, and the net income after income taxes for the last 2 fiscal years before applying for the loan is not more than $5 million. So that's kind of a catch-all for small business. So I guess the long and short of these two things in particular is everybody that's wondering if they're maybe in a gray area certainly needs to engage some legal counsel to help yourselves sift through and work through whether you might fall under a exception or a specific area of definition in the Act. In general, setting aside the affiliation thing just for a second, in general, the CARES Act expanded the universe of businesses that would be eligible for this program as compared to businesses that were typically considered small business concerns. So anyway, this guidance that came out last night on these first 2 bullets and the sub-bullets, the final caveat that was also stated there is that if your business falls under one of these 2 caveats or the under 500 or then you may they said it explicitly, this is a quotation, you may truthfully attest to its eligibility for PPP loans on the borrower application form, okay? Of course, then it gives the unless otherwise ineligible. That's referring to this affiliation. In my opinion, that's referring to this affiliation issue. So let's go to the next slide. All right. Does my business have to qualify as a small business concern in order to participate in PPP? Again, surprising answer, no. What are they getting at here? So in addition to small business concerns, okay, so this is going from the traditional definition of small business concern in the traditional SBA regulations, have that section 3, small business. So as I just mentioned, the CARES Act expands the universe. So what they're saying is if you're either under that traditional SBA concern definition or you're under 500 employees. So in other words, you can be a medium-sized business by, let's say, revenue, if that's how SBA looks at it. But as long as you're under 500, you will still qualify for the CARES Act PPP program. What's next? So are lenders required to make an independent determination regarding applicability of affiliation rules? So we're seeing this a lot. We're seeing a lot of the applications that are getting submitted. The banker on the other end is getting the application and wanting to verify things because, that's traditionally how a banker has to operate. It's a very regulated business. And so, their compliance departments, their QA, they're wanting to verify things as kind of a normal course of business. But in fact, this program is trying to be pretty liberal in terms of who gets approved. So explicitly, the government said in these, again, word for word in these FAQs that came out late last night, that it's the responsibility of the borrower to determine which entities are its affiliates and determine the employee headcount of the borrower and its affiliates. Lenders are permitted to rely on borrowers' certifications. So they're saying that the lender does not have to do that. No. Will they still? Just know that if you're in a discussion with your banker, you can point to these FAQs last night and say, listen, you're okay we're certifying here. We've got attorney representation. We've analyzed this with the attorney's help. This is our application. The regs say the bankers are not required to verify that. Okay. Third question, are borrowers required to apply SBA's affiliation rules? And yes, so borrowers are required to apply that. Again, getting good counsel. If you think you're in one of these areas that is not a direct a direct, obvious thing. Get help, get your counsel to help you understand and analyze whether you can maybe fall under one of the other categories of businesses eligible for these loans. Also, the recommendation from many people, and we would say the same thing ourselves, when you're applying for the loan, make clear to your banker which, if it's one of these, let's say, less obvious areas that you feel make you eligible, point that out to your banker that that's the case that you're putting yourself under. That you say, we think we're eligible under this condition, under this section of the rules. That way, if anything ever comes about later on, you have that to stand on. Listen, you made it clear that's the rule you're following, and it's a better way to go. Okay, so all that is assuming, all that is the discussion on the PPP loan program. What if my affiliation, let's say, with the hospital partner, or for some other reason, we're not eligible for a PPP loan? Is there any other option? In fact, there is another option. It's called the Employee Retention Tax Credit. It was launched by the IRS, again, about a week ago. Applies to wages paid after March 12th and before January 1st, 2021. Its stated purpose is to encourage businesses to keep employees on their payroll. Qualifying employers must fall into one of two categories. So either the employer's business is fully or partially suspended by government order due to COVID-19 during a calendar quarter. So obviously many surgery centers are in that situation. So if your surgery center is affiliate of a hospital partner and therefore not eligible for PPP, look to this as an alternate option for you. If your local government or state government has limited the amount of business you can do because of COVID. Second reason, though, is the employer's gross receipts are below 50% of the comparable quarter in 2019. So that's maybe a situation where a vendor maybe of a surgery center might be in that situation, or maybe surgery centers as well, but that's the other condition that would apply. It's an either or. Once the employer's receipts go above 80%, they no longer qualify after the end of that quarter. So that's the kind of where it starts and where it ends for eligibility for this tax credit. And these measures are each calculated quarterly, per quarter, I should say. So how does it work? The refundable tax credit is 50% of the first $10,000 of qualifying wages paid per employee per quarter. Most likely is what they mean by that, since we do the test quarterly. However, that is something that we're looking for further clarification on. So just to know that that is not yet, as far as I'm aware, been clarified. Wages paid after March 12th and before January 1st. So many people, many surgery centers, let's say, paid a week's worth of wages, even though there was no work to be done for many of their staff in March. It has to be a March check date, that is. So we should look to March in the 941s of the payroll taxes that we filed at the end of April, if you're in that position of being not eligible for PPP, but wanting to access this tax credit for those first quarter wages. They have a check date sometime in March. So the wages taken into account are not limited to cash payments, but also include employee benefits. So again, kind of jumping back and forth about benefits and how that factors in. The credit is available based on employer size. So if you're under 100 employees, and then you count all wages paid to the employees during a quarter, regardless of whether you've had a slowdown in business or not, is the way I read that. So you count everybody that's paid during the quarter. So up to $10,000, whatever that number of people is, up to $10,000. If you're over 100 employees, then the employer had more than 100 employees on average in 2019, then the credit is allowed only for wages paid to employees who did not work during the calendar quarter. So that would mean you'd take into account the wages paid to people that were paid during the quarter, and that is how you calculate your tax credit. And that tax credit would then, in theory, be used to pay payroll for people you're trying to retain. So it's kind of confusing, but I guess the scenario they're thinking of here is that there's a 2-week, 4-week, 6-week period where maybe people aren't being paid, and when they come back, then they are being paid, and now you're accumulating tax credits and using those tax credits to pay for the people while they're there. So a little bit confusing, and again, we're still waiting for further clarification on exactly how some of the aspects of this program work, but that's what we know so far. For ASCs that are excluded from the PPP loans, it's likely that they would qualify for more than 100 employee situation. So the exceptions, basically everybody's eligible for this employee retention tax credit, except for 2 types of entities: state and local governments and their related entities, number 1, and number 2, any small business that's applied for a PPP loan. So basically everybody else. Okay, next slide, please.
Okay, so the next thing we're going to talk about is repurposing your ASC and just some HR considerations. So let's talk about that a little bit. One of the things that surgery centers are being asked to consider right now is, could your ASC provide emergent services for procedures that are listed below? So such as infusion centers, childbirth, urgent care centers, orthopedic fractures, orthopedic trauma, acute appendectomies, and retinal cases. So what does that mean? What other things should you be thinking about if you consider having your surgery center utilized for these purposes? So some things to think about, will your staff be available to handle these emergent procedures? And some of these cases could be after hours, so it's something that you need to think about as you open your centers to these possibilities. What other accommodations do you need to make? Does your staff need some additional training for these emergent procedures? Are there maybe some additional PPE or control procedures that employees need to be trained on? So again, depending on your ASC's location, do you need to consider security issues, longer hours? Again, different times where centers are open, longer hours. Maybe these aren't well-populated areas, but things that you should definitely keep in mind. I mentioned already whether the staff needs to be retrained on infection control policies, specifically proper donning and doffing of PPE, hand hygiene, environmental cleaning. So all things to consider. One of the things that we really recommend is that you have your ASC discuss with HR or any state entity whether laid off or furloughed employees being brought back makes them a new hire, that's having to go through orientation and required training. Is that true? Is that not true? Well, by definition, furloughed employees are not considered new hires. So when an employee leaves and is on furlough, the whole purpose of a furlough is that you're bringing someone back. You're not bringing them back at a different location, you're bringing them back to the same positions. Now, sometimes roles change, so you do need to take a look at that. And some of it will depend on the length of the furlough. And why do I say that? Well, length of furlough, there may be some certifications and the like that needed to be kept up to date. So yes, while they're not considered a new hire, you're still obligated to keep your eye on required certifications, and then any expirations, potential expirations that took place while employees are on furlough. So you're not relieved of the normal day-to-day business operations of the system. So we really just recommend that you follow your established procedures and your rules on returning employees to work. So if you have a procedure already in place that requires some specific training when an employee comes back, whether it's a short-term leave or a furlough, you follow that same procedure. But they're not considered new hires. Another question that has come up is, will staff coming back affect their unemployment eligibility status? Well, that's one of those it depends situations. So staff who return to work are no longer eligible for unemployment unless they are working a reduced schedule and make less than the minimum state eligibility wage. So there's a lot of discussion about unemployment and wages and the like. The things to remember on that front are that every state has different unemployment eligibility wages. There are different minimums, different maximums, and then in addition to that, under the new act, there are also some additional payments for unemployment benefits. So the answer on this one really depends. Are you bringing them back full-time right now, or are you bringing them back on a reduced schedule? All of that plays into your decision making. We recommend that you really communicate strongly with your human resource provider to make sure that you're following all of the rules that need to be met. Now, this is another big question that comes up. Whose employees will work at the repurposed ASC facility? So if it is the hospital personnel that will staff the ASC, then presumably the hospital's risk insurance policies will cover the activities performed. So that's a question. One of those things that will need to be determined. Again, we are in new kind of uncharted territory here. And if the ASC personnel will staff the ASC, who is responsible for the management of the staff? Is it hospital management? Is it ASC management, or is it both? I mean, it's all things that you really need to consider.
Yeah, and that's, I mean, I think in this whole repurposing of the facility discussion, there are a lot of unanswered questions, and it's very, very dependent upon the specific situation that your facility is in. It just takes a lot of communication between the parties. I think that's really the only sure way to handle this is lots of communication and cooperation between the parties. But it could in fact be a case where you have an employee has multiple managers.
Yes.
Right?
Absolutely.
And so they're going to be following two sets of rules perhaps, and that's going to be tricky.
Again, so have you confirmed, again, a question, have you confirmed the ASC's liability and malpractice insurance covers enhanced emergent services? So again, if you're going to consider this, you need to make sure that you follow up on your workers' comp and your risk management to make sure that you are compliant with whatever your policy says. And if you're looking for an exception, that gets handled up front. You don't want that to happen after the fact when there is a situation or an issue. If you're performing hospital services, the risks are greater and they're different. So for example, typical workers' compensation code is 8833 for a surgery center. I'm sorry, it's 8833 for a hospital versus 8832 for a surgery center. And the cost for the 8833 code is typically much higher. So we've sampled a few states, and we're seeing that 8833 rates are anywhere from 2 to 3.5 times greater than the rate you currently pay for your workers' comp. Again, not a deal breaker, but something that you need to keep in mind, and you need to talk to your carrier about. And if your staff, ASC staff, staffs the repurposed facility and will be reimbursed by the hospital, make sure you're including all of the appropriate costs. And again, if you have a PEO, make sure you discuss the situation with them because there may be some employee issues that need to be worked out up front. So with that said, I'd like to move us into just some updates because it's never a week goes by where there aren't more updates and more clarifications under the FFCRA. So we'll just jump into those. We've taken some questions. Some of these questions are taken directly from the Department of Labor guidelines, and some of them are questions that have come in, and many times the questions overlap each other. So how do I know, and this is an employee asking the question, how do I know if I can receive paid sick leave for federal, state, or local quarantine or isolation related to COVID? So this part of the law is very clear, the act is very clear. The FFCRA requires that there be work or telework available in order to qualify for paid sick leave. And that's regardless of if there's a federal, state, or local quarantine or isolation order. There has to be work available for the individual to do in order to qualify for the pay. And you may not take paid sick leave for this qualifying reason if your employer does not have work for you. So if you have been furloughed or the center has closed because there is no work, then regardless, there is no paid sick leave either. in that situation, we recommend that employee take a look at unemployment benefits.
And there was a question that came up just now about unemployment. Can employees apply for unemployment if their hours are reduced for a short time until the PPP loan can be obtained? And we'd say yes.
And the answer to that is yes. They can apply. Again, each state is very specific as to their rules, but many rules have been relaxed during this period of time. So we always recommend that you've got nothing to lose by applying for unemployment benefits, because the rules have been relaxed quite a bit.
Yeah, and that's a general statement about unemployment benefits. It is a state-by-state thing, and some things vary quite a bit between states. So I guess there's no real one answer, but that's pretty sure in this case that yes, you can apply.
Yes, you can apply. And then another question is, as an employee, if I become ill with COVID symptoms and decide to self-quarantine or isolate myself for 2 weeks and then return to work, can I get paid for those 2 weeks under the FFCRA? Well, the answer to that one also depends. Under the FFCRA, you may take paid sick leave only to seek medical diagnosis or if a healthcare provider advises you to self-quarantine. If you did not seek any medical care or advice and you decided to do this all on your own, you are not eligible for benefits under the FFCRA. The other thing too, and there's been a little bit of confusion on this, is you're also not eligible for this leave under the FFCRA, which is the employee paid sick leave, if it's for a reason other than for COVID-19. So you have to have a diagnosis, you have to have sought medical care in order to be covered. So this is a key part. Some people maybe feel not well, and maybe they do have it, maybe they don't, but if they don't seek medical advice and have documentation to prove that, then they're not eligible for pay under this program. Again, can I take paid sick leave for any individual who is subject to a quarantine or isolation order who has also been advised to self-quarantine? And this is one of those tricky ones. The answer to that is no. Under the FFCRA, the leave is really designed to care for an immediate family member or someone who regularly resides in your home. So it's not just because your friend or your neighbor is now self-isolating that you can take off. You have to have direct involvement in that situation. You may also take paid sick leave to care for someone where your relationship creates an expectation that you care for the person in quarantine or self-quarantine. And this typically relates to an elderly relative, your mom or your dad. They don't live in your home, but they are a family member that may require care. And then again, please note that this individual must be dependent on your care. The fact that somebody's under quarantine or isolation doesn't necessarily mean that they need assistance or your assistance. So again, it is a very case specific. This is really meant to help each other during a time of need. The other question that has popped up quite a bit over the last few days is who qualifies as a child care provider? So a child care provider is someone who cares for your child. So that sounds simple, but here's really the definition. This includes individuals you pay to provide child care, like babysitters, nannies, au pairs, any paid arrangement you may have. But it also includes individuals who provide care at no cost without a license, such as grandparents, relatives, your neighbor, etc. So this has probably been a bit of a surprise. It is not always a licensed care provider. There are some other options. So it's the person who regularly takes care of your child, and they are not available to do so. Then unemployment. You can't have a conversation where unemployment doesn't pop up. When will unemployment begin issuing the additional $600 to my weekly unemployment benefit? So again, states had to wait for the Department of Labor to issue some guidance that happened over the weekend. The guidance was released. Now the states are tasked with implementing this guidance throughout their system. Some states will be quicker than others, let's be honest. Some states are more up to date than others. And some states have lower unemployment claims than others. So all of these things will play into the mix. But one thing that is important to note is that payments will be retroactive. So anyone eligible for unemployment benefits between March 29 and July 31st will see those benefits as soon as their states can process. So they'll make them retroactive, even if they don't start them until mid-April or later. And then this question came up last week, and it came up in a different format this week, so I'll answer it again. As an employer, can I furlough a salaried employee? And the answer to that is yes, salaried employees can be furloughed, but there's some things to consider. So when you furlough a salary employee, meaning you're not going to pay a salaried employee, that period must be for more than a week, and that the expectation is that they will perform no work for their employer. And this includes the 10-minute phone call, the quick answer to an email. If a salaried employee does any work, including that quick thing, the employer must pay the equivalent of their salary for the entire day. So they're not forcing you to go back and pay for the entire week, but they are saying you must pay for the entire day. So just things to keep in mind. So how long can I keep an employee on furlough? So typically, furlough means there is a job and you intend on bringing the employee back to work. Once the business is back up and running, employees return to work. In no case should a furlough last longer than a year. If you're really looking at closing your center longer than that, you really are looking at a real layoff at that point. Then you're better off rehiring people if and when the center opens. Another employee question came up, can I change my contribution to the HSA, the healthcare savings account? And the answer to that is yes, you can make changes to your HSA. Just always contact your human resource department. They'll walk you through what it takes to do that. And then one of the final questions that came in prior to the meeting was, can I change my contribution to the Fscra flexible spending account? A lot of individuals are finding themselves with closed centers and they know that they have over withheld for the year or elected a contribution that's going to be greater than they will be able to spend. So the answer to that is yes, you could change that as well. You could change anytime there's a change in daycare providers. In this case, your provider is closed. All providers are closed. Your child turns 13, that's always the case. And then the cost of qualified daycare expenses increases or decreases, and certainly this would be a situation where your qualified daycare expenses are going to decrease, and this was not something that was planned. So at this point, we'd like to open it up to more questions.
Yeah, we had just a couple of questions came in. I think we answered many of them. Actually, they're kind of contained already in the Q&A we had prepared, and then a couple other questions. But if there's anything else out there, we have about just about 10 minutes to go. If there is anything, back to this PPP loan program. I know, we're an HR services company, so typically we may not be involved in answering those sorts of things. But it's such a employee-centric program, and our motivation is to help everybody get their employees taken care of. So we're definitely tracking that quite a bit and supporting that through providing payroll information to the surgery centers that are trying to apply for those loans. If there's nothing else that comes in, looks like we've got everything taken care of as far as questions that have come up. So I guess with that, we will sign off and say thank you once again for joining us. We really appreciate it.
Thank you. And again, we're available for questions. So if you have any questions after the fact, please feel free to submit them. We'll get back to you.
Have a great day, everybody.
Thank you.